Hi, my name is Esther. I'm a registered nurse and would like to talk to you all today about the Gardasil 9 shot. This is also known as the HPV shot, or the human papillomavirus. HPV is easily preventable with vaccination. This is called Gardasil 9 commonly. It treats the 9 types of HPV that are known to cause cervical cancer, vulvar cancer, vaginal cancer, anal cancer, and oral cancers that are related to HPV. HPV is sexually transmitted, so it's considered a sexually transmitted infection. HPV is spread through intimate skin-to-skin contact. There's over 100 different subtypes of HPV, and 90% of people clear HPV on their own. However, that leaves 10% of people that will develop some sort of HPV-related cancer. 26 million, this is the number of girls 13 years of age in the United States. 168,400 is the number of girls who will develop cervical cancer if none are vaccinated. 54,100 is the number who will die, according to the Centers for Disease Control and Prevention, or the CDC. They will die from cancer, cervical cancer, if none are vaccinated. The United States is staying at about a 30% coverage rate for these vaccinations. If we only stay at a 30% vaccination rate, 4,400 is the number of future cervical cancer cases we will not prevent, and there'll be 1,400 deaths from cervical cancer if we do not promote vaccination. So my encouragement to you today is to get vaccinated or have your children vaccinated. Cervical cancer cost, according to the National Cancer Institute, is $7 billion and 3 million cases every year for females. That is astounding, especially when it's so preventable with this vaccination series. The Advisory Committee on Immunization Practices, or ACIP, recommends the HPV vaccination, or Gardasil 9, at ages 11 to 12 years of age. This is optimal because since HPV is sexually transmitted, most 11 and 12-year-olds are not sexually active yet. However, we can vaccinate both males and females through the age of 26. It comes in a series of 3 shots. You would get one initially, you would get your second in 1 to 2 months, and then you would get your third shot 6 months from the date of your first shot. It's given intramuscularly, or IM, and that's likely going to be up here in your deltoid area. Might be a little painful going in. The arm might be a little bit sore for a couple of days. And that's easily treatable with some Tylenol or some ibuprofen, and you can take that every 4 to 6 hours as needed for the pain. Since we have talked about some HPV facts and HPV prevention, let me tell you where you can receive the Gardasil 9 shot or the HPV shot, and this would be at your local health department. If you have a cervical cancer diagnosis, let me tell you that I am truly sorry for your diagnosis, and there is a good support group at inspire.com. That's INSPIRE.com. And this is a group of women that also have cervical cancer, and you'll find that a great place of rest for your mind and for your soul when you're burdened with a cancer diagnosis. So my takeout point from all of this speech is make sure you're taking your children to get vaccinated. That way they are not faced with that diagnosis of cervical cancer or vulvar cancer, vaginal cancer, anal cancer, or oral cancers that are easily preventable with this shot. And also, if you are a female or male 26 and under, please go out and get vaccinated. I hope this helps.